Good morning, everyone. My name is Nicole Alexander, and I'm with the California Community Colleges Chancellor's Office. So I want to first off take a moment to thank everyone for taking time out of your busy schedule to attend our webinar today. Today's webinar will explore the brief crisis intervention model, which provides immediate response and short-term support to help students remain in school. This session is provided by the California Community Colleges Health and Wellness, which is a partnership between the California Community Colleges Chancellor's Office and the Foundation for California Community Colleges. The goal of CCC Health and Wellness is to support all 115 California community colleges in identifying, implementing, and sustaining strategies for addressing student health, mental health, wellness, and basic needs. So I'm going to take a few minutes just to quickly introduce our presenters. Our presenters today are Dr. Monique Crandall and Philip Van Son. Dr. Crandall is the Director of Student Affairs Case Management Services and co-chair of the Behavioral Threat Assessment and Management Team at the University of California, San Diego. In this role, Dr. Crandall coordinates crisis support through strategic intervention, case management, and collaboration with campus departments, faculty, and staff. She also strengthens campus-wide crisis prevention efforts as well as coordinates post-incident campus response. Dr. Crandall's clinical and research interests include behavioral threat management, structured risk assessment procedures for higher education institutions and other large organizations, motivational interviewing, and strengths-based approaches to retention, coping, and engagement. Dr. Crandall was a motivational interviewing clinical supervisor for the University of Missouri Greek Health Study with the aim of improving student engagement and targeted healthy behaviors. With a focus on prevention, Dr. Crandall is actively involved in distress student response training, crisis de-escalation, and threat assessment and management. She has served as a consulting psychologist to the California Community Colleges regarding training systems on their approach to recognizing and responding to psychologically distressed students. She earned her bachelor's degree from the University of California, Irvine, and her Master of Education in Counseling Psychology and PhD in Counseling Psychology from the University of Missouri. Our second presenter today is Philip Van Son, who's the Director of Risk, Security, and Resilience for the University of California Office of the President. His work, research, and teaching focuses on vulnerability reduction, risk and threat management, risk sensing, gaming, and decision-making. He developed coursework and serves as a lecturer in the UCLA Enterprise Risk and Emergency Management Certificate Program and lectures in the Research Ethics and Urban Studies and Planning programs at UCSD. Following military service, Philip served as a consultant to the White House Military Office, providing crisis management training and support to the White House support personnel. In 1990, Philip was awarded the Presidential Service Award for his service in the White House. Philip is a board member of UCLA Extension and a member of the State Department Overseas Security Advisory Council, the Association of Threat Assessment Professionals, and the Higher Education Case Managers Association. He holds an MA in Communication from Trinity University, completed the executive program in crisis management at Harvard University, and the Scenarios program at Oxford University. He is also the author of Failure is an Option, a primer and guide for managing crisis. So once again, thank you to all for joining us today, and I'd like to welcome our speakers for today, and at this time, I'll hand it over to our presenters.
Thank you, Nicole.
Good morning, everyone, and thank you. We have 4 learning objectives for this morning that you'll see on the slide. And briefly, what we want to do is provide an overview of practices for brief crisis interventions in our community and share with you some of the thoughts that Monique and I have been working on for brief crisis interventions. Moving through that, talk a little bit about cases, so we will share with you some examples, and then talk about planning so that when you leave here, you've got some additional support and resources and take your questions. So we want to leave time at the end of the session for questions. And with that, I will turn it over to my colleague, Monique.
Thank you, Philip. The first thing that we wanted to do is we wanted to check in with everyone that's joined us on the call today and get a sense about your role and whether or not that role includes conducting brief crisis interventions with students. So just if you have an opportunity, we'll take an opportunity to use this polling and get a sense about who's joining us on the call and how we can best understand a little bit more about your role. We probably have about a third of the individuals that have joined us on the call already responding, with everyone noting that they do have a role on campus in conducting brief crisis interventions with students, which is great. That means you're in the right spot today. So I wanted to be able to get a sense about that, and we're going to really spend some time tailoring some of this information to you today, so that way you can have a better understanding about that. And I'm just going to wait as we see if there's any other individuals coming in that may want to be able to respond to the poll. What we wanted to get a sense of is whether or not that is included in your role, or even as you see as you utilize the chat box, if you feel like there are additional parts of that role where it ends up being in addition to some other roles that you may have on your campus. So I'll go ahead and end the poll here, since it looks like we have the majority of the individuals saying that this is included as a part of your role. So what we wanted to start off a discussion with is just to be able to touch base about this developmental understanding and get that basis for understanding a little bit about the individuals that we're seeing within our institutions and having that better developmental understanding. So as we look at some of the things that we're aware of with the population of students that are matriculating through our campuses, half of all of the serious adult psychiatric illnesses start before the age of 14. Often they progress undetected and untreated. That may mean that it may start off as something that maybe families or individuals, younger age individuals, may not have a sense about some of the changes that they might be going through, or even a sense that just how much of a negative impact they might be having on them moving forward. Oftentimes, the mental illness can be sometimes defined as like this normative part of maybe adolescence or even transitioning into adulthood. This idea about it being typical for youth to have this storm and stress, this understanding and piece around, yes, that might be a little bit more common, or that's just you going through your day, or maybe you're just having a tough week. And so that's something that some people might internalize, but it also may be sometimes the way that our external environments might approach the ideas around mental illness. And then as we look to some National Institutes of Mental Health information, an estimated 1 in 4 U.S. adults suffers from a diagnosable mental disorder in a given year. When we see that number translating to our populations of the campuses that we're working on, we really have some better understanding that this is a significant effect on our campuses, and this is something that really we're looking at to see how can we best support those individuals that are arriving on our campuses. So what characteristics, and I encourage you to utilize the chat box for this, what characteristics do you see in the students that are presenting to your campuses around just some maybe developmental understanding around stress or some difficulties with mental illness? Maybe they're not initially identified that way, but they may talk about them in different ways, such as being overly stressed, not being able to get sleep. So I encourage you all, while I'm talking through this, to utilize that chat box and give us a sense about what are some of those sources of stress or those characteristics that you see in your students with regard to talking a little bit about some of the concerns that they have and how they're moving through those. As you all discuss those, I'll also keep a look on the chat box and move into some of the pieces around the support too. As we talk a little bit about those sources of stress, oftentimes those initial sources of stress from the ACHA data include depression, anxiety, stress, and sleep difficulties as some of those common identifiers of sources of student stress. I'm also seeing that other individuals are recently identifying basic needs, housing concerns, and just some of those basic needs that have been identified as other components that are definitely affecting their mental well-being and their ability to really focus on what's going on for them in order to be a successful student. Some of the trends that we're also noticing is this number of college students experiencing mental health challenges, but also tied in with the complexity of those challenges. So some of the pieces that you're mentioning with regard to maybe having some housing concerns and then coupling that with whether or not that's maybe some inter-partner strain or relationship concerns, some underlying mental health disorders or those types of things. So we're definitely seeing that it's a coupling of a complex array of concerns that your students are approaching you with. I think also tying into that, what we're consistently noting is this limited access to psychiatric care on site, whether that be additional support or whether that be the appropriate level of support that particular individual might need at that given time, that we can no longer identify what are those streams that might be the most effective, and those resources are often limited on our site. What we also see is that the ways that the support is really beneficial is when the students are not attending, or we see that them enrolled in college or university environment as a protective factor. So when we identify those that are no longer attending college, often we see that as connected to maybe a mental health related reason, and that oftentimes when it goes unnoticed or undetected or unsupported in the resources they can have, that those mental health challenges may worsen. But there is that recent information, and you'll see that link down there that can be a really helpful tool for any of your areas, that early identification and targeted identification with interventions can really promote that change for these individuals. And that really comes to the fore when you see that they're identifying this place of belonging, really having that maybe one touch point or some smaller touch points identified within that college environment can really serve to promote that change, because it serves as that incremental opportunity to see that slight change, which probably they've been really struggling to identify for themselves. So I really appreciate the information that you all are sharing, and I think using these examples that you're providing with these complex array of concerns that you're seeing the students come to the fore with, I think it's going to be really helpful to continue to inform how we talk about these, and we'll continue to use some of those examples moving forward. I'll turn it over to Philip now to talk a little bit more in depth about the indicators of concern.
I think it was very helpful, again, for all of us to see the types of challenges that were listed. One of the challenges that I've noticed in working with behavioral intervention teams is that the institution's leadership might not be as familiar with these challenges as we are, because we see them every day, and they might ask for an immediate response. So I think that's helpful for us as practitioners to understand the challenges for the institution. In terms of the indicators that you see on the slide here, we're really thinking in terms of clusters of behaviors of concern. And so most of these will be very familiar to you in terms of what was listed before. One of the other areas I'm going to move into then is these stabilizers and what will help for the practitioner in order to connect someone who's in a state of crisis to a resource. I should say, though, as probably has become very obvious, when there is a direct intent to harm self or others, we are not or should not be looking at a behavioral intervention team model. We should be looking at an immediate notification. And I understand for many of the community colleges, this means your security department or your police department. So the other feature here that we've seen, unfortunately, across the nation is a belief that there should be a direct threat in order for the police or safety to be notified. I'm sure I'm preaching to my peers here, so to speak, but we need to dispel that belief that there needs to be a direct threat in order for the police or safety to be notified about a concerning behavior. I'm also going to touch briefly here, and we wanted to ask the question in a polling about your understanding of FERPA. And again, this might also be an institutional issue, but beyond the institution, we think it's important for us to, as educators, to educate our constituents about FERPA. Because this has been a primary issue in many of the cases, we're asking the question here, and I want to wait for the polling to come in, but the question essentially is it your understanding that FERPA allows you, based on your interpretation of what constitutes a health and safety emergency, to make a non-consensual disclosure of student information to a third party, such as the police or a student's parents? So it looks like overwhelmingly the majority, as the results come in, that is their understanding of FERPA. And again, in the trainings that we've provided across the state and across the nation, This has become, I think, an issue where practitioners are now more fully aware of FERPA, but again, I would suggest that some of those that we are helping, including in the leadership of colleges and universities, don't have that understanding, and so they're still citing FERPA privacy concerns. One other point I'll make here in terms of FERPA, as you see the new slide here, I think Dr. Applebaum, the director of the Division of Psychiatry, Law, and Ethics at Columbia, made a really good point here, and we wanted to share this with you. The bottom line is that administrators and clinicians have much more discretion than they may believe with regard to sharing information. So in getting ready for this webinar, both Monique and I looked at the exact language in FERPA, and it does not describe what a health or safety emergency is. It leaves it up to the institution and, in fact, the individual at the institution. So all of that to say, I think for those of us who are practitioners, we perhaps, and the survey results will show this, we understand this, but I think we still have quite a ways to go in terms of helping our administration and our constituents understand this as well. So the other issue here, and I see a question that has been asked, the difference between notifying parents and police in terms of FERPA information. The code itself does not make a distinction. It says third parties, concerned third parties. I understand in practice there is nuance here, so I don't mean to give a short answer to a complex question. But certainly with regard to police, to provide them with information that might assist you in helping a student in crisis, there are FERPA boundaries are clear. It says that if you believe there's a health or safety emergency, you're free to share that information with third parties. Parents might be more difficult, and we're going to talk through cases which I think will serve as a good exemplar of this practice. I would just suggest here there's no one-size-fits-all answer, but the misunderstanding of FERPA in its application has led to some confusion about reporting. I'm also going to bridge here because many of you have probably worked with your Office of Student Conduct, and again, in many of the case reviews that Monique and I and probably many of you on this call have had, you notice a cluster of behaviors that often start in the classroom. So clearly, beyond crisis interventions, we have, I think, a lot of work to do with our faculty members to inform them of both FERPA and their responsibilities in the class. So we're going to ask the question here, what intervention strategies are our colleagues on the phone currently using? What our polling question here that's been pulled up is, before you meet with students to discuss behaviors of concern, do you take time to consider and practice how you respond to unacceptable behavior from the student during the meeting? All right, this is outstanding. So clearly, I think what we're learning through this polling, and I'll end the poll here, it looks like 96% do in fact engage in a planning session before you're meeting with students, and these are the best practices. So we're not surprised to see that in this cohort. In terms of intervention strategies, this is from Calhoun and Weston, and it's more focused on threat management. But the idea here is that saying to a particular constituent that we are going to interview a student or a faculty member, well, we have a range of intervention strategies. And the first, as you see, it says no further action now. So the idea is that sometimes intervention means let's see if this was an aberration and not to overreact. I think, and Monique and I, and probably, again, most of you have probably had this thought of doing no harm, of doing the least invasive process first. So all the way through, unfortunately, to the potential that there might in fact be police intervention, which could end in an arrest. And of course, we're not in any way suggesting that all interventions end in this. So this is a spectrum across the range of strategies. I'm going to turn it over to my colleague, Monique, and we're going to talk about now more specifically the crisis intervention model.
Thank you, Philip. And I think with regard to safety planning, as Philip was mentioning too, it's also what is that support network that you have to be able to really fully engage in this intervention process. A lot of what Philip is also alluding to is those practice sessions, is preparing ahead of time for what that looks like. And a practice session often can include engaging with those groups that you might be bringing in. So a practice session, I noticed multiple people on here talked about first starting with connecting with a faculty member and getting some additional information about their concerns, or connecting with some other resources and identifying a strategy beforehand. I think those are excellent opportunities to actually practice them out too. Too often I have heard in situations where the first time that you're calling the police or you're calling your public safety department is when you're actually actively involved in an intervention, a brief intervention. And so those relationships, just the same way that you would build rapport with the students, those relationships can be practiced out, can be connected ahead of time, so that when you are making that call or you are engaging and talking a little bit about some of the things that you might need in that process, that relationship is already there and it doesn't have to be struck while you're in the middle of a crisis. Totally understand that that happens oftentimes, but it is a great opportunity to do that ahead of time. And I'll touch a little bit more on the post-intervention process and documentation here. It's always great to start a little bit about what you want to do and how you want to intervene and what you might want to document going in, so that you already have those things set out. This is going to be really helpful for you. It also is really helpful for those of you that have sites where you may have trainees or you may have somebody that isn't a little bit more distant from doing this on a more regular basis. So if you can provide them a little bit of structure around what's the documentation that you need, many of you all have those care reports or reporting resources, that's going to be a great place to be able to identify what's that structure and documentation you need before you even engage with the student. And we're going to go ahead, since we already heard that many of you all do take that time to consider. That's fabulous. We're going to move past into the guidelines for that brief intervention. So oftentimes when we think about this, we often think about what are the places that we want to focus on. I like to be able to come to the point where how can we support those facing that point of engaging with the student. These are great reminders to remind ourselves when we might be engaging with that student or when we encourage somebody else to engage with that student. So this is, again, the places where establishing that rapport quickly but in that goal-directed way can be a good opportunity. So meeting with the student in private really is going to minimize that concern about embarrassment or defensiveness, especially as we start to move to this place of having these public reporting options for students, faculty, and staff. Then we want to also make sure that we're coming from a place of caring and support and not a place of reporting and requiring to reach out. When we establish that culture of caring across our campus, then we understand that it will increase that opportunity for people to utilize those resources, such as a care report option or a drop-in service that many of you all had mentioned. It is also helpful to openly acknowledge the student that you're aware of the distress. At this point of a brief intervention, it's okay and appropriate to move directly into that so that we can identify what that looks like, whether that be commenting on some of the nonverbals that you're noticing in there, or commenting on, I understand that you're heading into a very intense time or that you haven't been attending class for this many days. These are some things that I'm aware of that might be indicators of concern or indicators of distress. And following that up with, this is something that I'm willing to help with. I'm willing to be able to check out and see what other resources might be available to you. And then you want to see also what are the pieces and listen carefully to what the student might be troubled about. So an example might be if you're hearing something from a faculty member in a report and maybe they say, this individual hasn't been to my class, or they were super engaged in the beginning and they're not engaged anymore. I really think that this has to do with their academic concerns and they're probably really concerned about that. It may be helpful, as many of you all had addressed, that these are often more complex and add in a lot of these other personal and individual struggles as well. So it can be helpful to see what are the places. Do they agree with that? Do they disagree with that? Are there things even more pressing happening? Is it a housing concern and that's why they haven't been consistently attending their classes? Is it something with regard to just not being able to think about where their next meal is coming from, and so it's really hindered them from being able to focus on their academic progress? So listening carefully to what that trouble might be and trying to see if this differs from what you might have heard or how it might work in conjunction with some of the information that you're receiving from other parties. Some sample interview questions and just interview prompts that can be helpful. This is a great opportunity to incorporate this structure within your models. Just opening up that conversation about focusing on what is the information that you received and why might you be engaging in this conversation now? Really also leaving it open to say, tell me a little bit about what your understanding of this is. Tell me a little bit about what has happened for you in that. That gives you the opportunity to hear about other pieces and also not make assumptions at that point of what's going to be the best intervention. Oftentimes we think, oh, we might need to have the student be evaluated or have the student be connected with one specific resource. When we do that, we may lose out on some other opportunities that might be the more primary effective intervention. I think the other piece is if there's any concerns around maybe a behavior that they may have engaged in or some other pieces, even just about accessing that resource, talking a little bit about more of that goal orientation. This gives you a couple of pieces. This is an opportunity for you to get a sense of whether or not they all are goal-oriented or goal-directed in any of their behaviors, or if this is something that, maybe is just kind of a lack of options or maybe more of an escapist idea. So that definitely gives you some help for that. It may also be helpful for you to take a little bit of a quick 360 view. Tell me a little bit about how things are going on for you in other environments, whether that be school or home or maybe in a relationship. It could be helpful to use that as a quick guide for you to see at what places are you going to want to really focus in on that intervention. And then is there anything else that I should know of? Always leaving that opportunity and option to, again, drop any of those assumptions and say anything else. This is a great opportunity to say, I'm not really sure if there's anything, but I leave it up to you. These can also serve as excellent training questions for those of you all that do provide that training within your places or offer those opportunities to connect with resources. And again, I really like these as good prompts for faculty and staff that are going to be reporting into your areas so that they can feel a little bit more equipped in even starting that intervention process with a student. So as we look again to additional guidelines for that intervention, attempting to identify not only what are the concerns or the problems that student may be approaching you with, but what uneasiness or concerns do you have in hearing about that problem and connecting with that concern, and maybe even it might be a self-reflection of saying, wow, this is going above and beyond what I can provide this student right now. So checking in with that and understanding that that can be a good gut check feeling about the need for consultation afterwards, the need to include others in that opportunity for support, and involving a little bit about checking in around what are some of those other things other behaviors or other inappropriate things that you might be noticing either in the communication that you're having with the student or in just the engagement that other people have had with that student. So it could be commenting directly on what you might have observed or connecting back to and asking further questions around some of the behaviors that they had exhibited in other settings. So one example is having a student, I've engaged with a student regularly around having then really inappropriate comments that involve sometimes racial slurs to a faculty member or to a staff member. And oftentimes noticing that is in conjunction with some of the increased stress that he is experiencing at a particular time. That increased stress is connected to the increased academic concerns, but also some personal stress. And, oftentimes getting that opportunity to comment around maybe the words or the language that he used and learning a little bit more about his intent can be a really helpful window into understanding a little bit more about how you best can support that student or what other resources can be helpful. Also involving yourself in that process is you might want to reach out, but there are also times where you may see that becoming more involved can be maybe some difficult at that point. So when we think about these brief intervention processes, we often think about these as a starting point. This takes off a little bit of pressure from you as being the one that's intervening. If you're thinking about this as a starting process of the full intervention process, then I think it can assist you with seeing a little bit about how do you move forward and not feeling the pressure to make all of the adjustments and changes in that moment. Sometimes it's a very, very short moment that you'll have available to you. And then we also have the reminder of your mandated reporting responsibilities, that legal responsibility of some of those things that you've heard. And it may be helpful this is definitely an opportunity to consult with supervisors, consult with those within your campuses to learn more about how you might do that within your sites and what's your responsibility there. And understanding the timeliness of those reports as well, all within this process. So the other piece is closing the interview session. So offering that practical assistance. And when I talk about practical assistance, it's giving those action-oriented options to the student. What are some things that are going to be their next steps? And how can we chunk those next steps into manageable and identifiable steps? Oftentimes within a crisis intervention setting, we think about all of the pieces that need to be there, but we also have to remind ourselves that those in crisis also are having difficulty probably approaching any of those things, and they see them and perceive them as larger chunks. So whether it be breaking it down to making that first phone call, whether it be even giving them the space to make a phone call to connect with the resource, seeing a little bit about what that chunk is going to be available, and connecting a little bit about how can we best support you in making that next step doable. Connecting to social support can also be helpful, whether that's local social support and actual other resource on the campus, family, friends, clergy, other support within their social networks, cultural identity networks, can be also additional opportunities for not only them to connect with social support, but for potentially you to have an understanding about their support network and other options that you may have the opportunity to reach out to. And then if there's any opportunities for releases to those individuals, that could also be a helpful practical assistance tool for you moving forward. And I think the other pieces too, and I'm going to scroll through these as well, but providing those education and resources, links to services and referrals. And in addition to the links and services, I often like to be able to provide that additional personal information about those links or resources. I love going to the Academic Resource Center. These are some of the things that I learn about the Academic Resource Center when I'm there, and providing a little bit about that even warmer handoff to some of these students. Advising the student is what to expect as a result of maybe a meeting, setting those guidelines for them, and also setting the guidelines for that follow-up. What does that follow-up meeting look like? Is it a phone call? Is it maybe following up with another member of the campus? Or in what ways are you really going to have an understanding about their compliance with any of the interventions or assistance? And I know Philip wants to be able to share in a little bit about some other pieces here as well.
Again, I sense that Monique and I might be saying things that are very familiar to you all, and I think that's helpful. It reinforces that we're all working in the same and similar ways. So this might just be a thought that reinforces what you've already thought about, but I believe, and Monique, you can correct me if I'm wrong, I often, when I'm towards the end of a interview, especially with a student, I sense that the student now sees me as the face of the institution. In other words, that, you've asked me to provide you with feedback. I've provided you with feedback, and now I expect that, or I sense that you now will solve, so to speak, these issues, especially potentially with a faculty member. So at least in the sessions that I've conducted, and then I'll turn it back to Monique, and I'm sure others on this call have had similar thoughts, I like to let students know I will now take this information that you've given me, and I will go back and I will provide feedback, basically letting them know, as Monique has put on this slide, the last item, what's going to happen next. I tend to suspect that the student will now see me as essentially the face of the college. And I try my best to say, my job now is to take what you've given me and to try to help you through this process. And there are other aspects of this that I do not control. So just being very clear about the process to help someone navigate what happens next. And so I'm not sure, Monique, if that tracks with your experiences, but I'll turn it back to you there.
Yes, I think that is really where the student is going to see, and in some ways you want that this is going to be that small opportunity that you have with the student to have that touch point now. And again, that touch point can be even as minimal as having that email reach out. I've had students that have said, even just getting that email and I've even had some students have never not responded to it for months, but they held it in their email inbox knowing somebody out there was being that point of contact for this large place, and even just knowing that it was there, I knew I was going to come back to it, but having that be that name, be that email, be that one point of contact that's going to have them be a sense of support for them. I'm aware that I'm seeing some comments that are coming in around understanding the bit processes, understanding what your bit team structure is. I'd love to be able to comment on that. We are going to come back to that at the end because I think there are some additional resources that would be really beneficial to having that understanding. I'm also going to walk through the post-intervention process. Again, these are things like Philip was saying that is maybe not new, but also I think there's some additional components that we like to highlight here. So focusing on documenting the actions that took place. And oftentimes when we look at the brief crisis intervention models, we start to focus on what are all the things that the student reported to us. Did they say this? Did they say that? Those things are definitely important and helpful to highlight. In addition, it is always helpful to focus on what were your actions steps that you took in that intervention. In what ways were you a part of that meeting? And when we talk about that, that's often maybe it's I asked about self-harm. I asked about danger to self or others. I asked about what additional resources or support systems are available to them. So oftentimes when we look back and we see some of the documentation, it's really focused on what was reported and less focused on what was asked. However, in an effective intervention process, we can already see some of the places and the opportunities that you took and the strategies that you employed, and that's going to be really helpful for you moving forward. Or if for any reason this crisis intervention bubbles down and comes up again months later when maybe you're not even a part of that process. This is also an opportunity as part of the post-intervention process to report back to any of your support teams. Many of you all had identified that these teams are available on your campus. So in what ways do you report back those findings and how do you consult? This is helpful to identify what that structure includes. So that might include monitoring that compliance, which I think is a helpful identifier in seeing where the progress of that intervention is. So it might include what are the considerations for noncompliance. So it may be that the student had said that they had attempted to engage in mental health treatment multiple times but have not returned, or that the student said that they had a prescription for medication but they never filled it. So understanding a little bit about what those considerations might be based on the information that you receive from the student or even from others. And then that is also that noncompliance or compliance with what you all discussed is going to determine whether or not your intervention is complete. And this is often the way that Philip and I like to identify it is, yes, that interview and that meeting is just the start of the process. What feels complete to you? What feels complete to your campus? What feels complete to maybe other reporting areas that you have? And then with that, there are opportunities also to reassess. The noncompliance is an opportunity for you to reassess those interventions. It might be even to chunk those interventions down into smaller components. And what does that look like? The opportunity to reassess should also often happen every time a student does a follow-up for a meeting, whether that's a missed follow-up phone call or a missed meeting with you. Those are definitely opportunities to say, how do I adjust my intervention strategy, or how do we adjust the outreach to this individual? I want to leave it as we move into the next piece about some ongoing practice, but are there any questions? We do have some opportunities here to take any of those questions now. A couple of pieces that, as we are sitting here as well, is that some of these components of the post-intervention or even the intervention process include, this is, supposing that there is a level of infrastructure already in place in your organization. I understand that just even looking at some of the information that you all are providing in the chat box, there's definitely a structure in your location. And there may not be a structure at others. So the BCC Health and Wellness website has additional resources and can offer additional assistance on developing that infrastructure, particularly as it relates to behavioral intervention teams and crisis intervention teams. I think looking a little bit around what those resources might be available if there are locations that maybe don't have as much of a structure or are looking to implement more structure based on the information that we're showing up here. I do have a question about some pieces related to work with the students. So I want to make sure that we're getting that information out to you. Sorry, I'm trying to get the full information. So I think the question is about engaging with the student or integrating them into the process. Maybe if there's additional clarification, but integrating, if it might be integrating fellow students into the process or integrating the students that you might be intervening with into the process. So if there is any additional clarification on that, that would be really helpful. But some of the pieces that we want to be able to include are just those opportunities to make sure that you're connecting with them on different levels. So I'm going to move into Philip, and we can see if we can get some more clarification and move forward with talking about some of those opportunities.
Thank you. This area here that we've put some information here, we wanted this to be for you to think about moving forward in terms of your staff training and for your own thoughts about maybe perhaps taking information from this webinar and making it stick, so to speak. And so one of the ideas is doing casework, like Learn at Lunch sessions, where you talk about either a previous case scenario that you've dealt with or taking out the specific information of the student's name, but just talking about a vignette. And we've done this with our staff throughout the University of California system and with our consulting with the community colleges, essentially working through the discussion about developing an interview plan, gaming out, again, as the slide talks about, your potential response options to different behaviors. And again, this isn't just about behaviors of concern, but practicing your sessions, and then working with your team on different and various approaches. And we think that's the whole idea of the multidisciplinary teams. And so integrating that into a professional development cycle that you can do without any external resources. So from that, we're going to talk now through some cases, and I'm going to turn it back to Monique. This is, again, just to give you an opportunity to see how you might incorporate case vignettes here in the practical sense, but also beyond the webinar. So I'll turn it back to Monique.
Yeah, so with regard to these case vignettes, these are something similar that you may have in your trainings or other trainings that you may see if you utilize Cognito, for example. And it does provide you with a little bit of just setting the stage, very similar with identifying some of the indicators of concern, the stress, the academic concerns, the concerns around suicidal ideation. These are all components that we've definitely seen as common core concepts that we want to be able to talk through with regard to any crisis intervention. And I'm going to give you another example right here, Manny, which is just an additional information, some pieces that might be helpful with regard to potentially their veteran status, their exposure to combat, difficulty learning, concerns around financial concerns, and also concerns around their academic progress. Now, what I think is often really, unique in these is developing those action plans, generating, how are we matching the person's degree of risk to what ideas that we're connecting to? In what ways are we utilizing the strengths that you heard throughout that assessment process? And these are good places to focus your information around how might you look a little bit differently at the vignettes that you use in your training. So what ways might you focus on those incremental goals? What ways might you take concrete action? So it's a little bit of a shift from just the ways that we might regularly go through any of our vignettes. So for example, I'm going to move back a little bit, but joy, I think, is a perfect example of it's an easy place to look at some of the places of indicators of distress and those markers of concern, but it can also be a great opportunity to see what are some of those strengths that we're already noticing that we can pull into the intervention session. Understanding that she's really tied to academics, understanding that she has reached out to maybe academic counseling to check in with somebody. So seeing that she has utilized those appropriate points of engagement can really be great opportunities to connect with Joy in those meetings with her. Same thing with Manny, I think, looking at some of the places where, what are some of the things that he's spending his time doing? How can we connect with maybe some of the resources that might be available if he's connecting to the idea or to the affiliation or identification of being a veteran? What additional resources might we be able to employ with this student, and how can we assist him with other resources that even may be available on our particular campuses? A little bit through your vignettes and the ways that you look at them is, what are some of the pieces that you can practice out that risk evaluation, connecting with your colleagues, again, working through all of the scenario pieces that Philip was talking about. One thing that Philip and I also like to do is provide some additional injects into a scenario, if you will. So not only is Joy presenting with some of the concerns that she had before, but also looking at now she's in between your appointments. Now you have to identify what those priorities are. The self-report is not lining up with what you heard from the student, which I know is a lot of what people are mentioning. Or there may be a reluctance or a non-compliance. So in what ways are you connecting with that now? And same thing with this one for Manny. In what ways might you present, what ways might you support a student, or what intervention plans might you be thinking about if somebody's presenting to your center just before closing, if they appear under the influence, if there's some additional information that's going to be helpful for you in those situations. So it's helpful to look at some of those opportunities to see what are the unique things that you can do to add to those scenario-based training opportunities. And I'm going to throw it back to Philip so we can talk a little bit more about any tactical crisis management opportunities.
Just to connect to the point that Monique made, and one of the comments in the chat was assessing intent to harm self or others. That is, we should have, made the point. That is, of course, a part of crisis intervention. In fact, when we talk about preparing for the interventions, the idea that we're making a risk evaluation, asking the question is, has the student thought about hurting themselves? As you all know, that does not, this is not going to trigger suicidal thoughts. So that is part of the planning process, and those are the questions that you want to have as part of your intervention strategy. The other is this idea of, and again, I'm going to kind of connect this thought to self-care, the idea that it's going to be good enough. I'm sure many of you can probably relate to the idea and the thought that when you're engaging a student in a first intervention, often we will feel as if there's just so many needs, and how can we provide for all those needs? So we're trying to give the sense that we are gathering information in order to provide resources and support. Connecting to our colleagues, we're not alone in this, and again, I feel like this just reaffirms the messages that we've talked about here previously. Also, in terms of the vignettes, we've provided these short scenarios as fodder for your casework beyond the webinar. We really do think that using these as part of your in-service training are helpful, both for your continuing development, but also to sharpen our services by making the vignettes more closely resembling those that you see on your campus. Obviously, it's connected to culture. Then the idea here for our time is to give you an opportunity, and also when you do your casework, so I'm blending the two thoughts here, both the webinar, but taking the material away here, working with your colleagues to ask the questions, what have we learned through our training and our casework, and what have we done well, and coming up with ideas for improvement. So we typically ask, 3 things we've learned in the process and 3 things that we'll do differently. And then what parts of the scenario tested our systems. Were we close enough to our referral process? Is this the way we would like for a referral to go? Is there another way of doing it? For instance, as Monique mentioned, the idea of manufacturing soft landings. We often will call one of our agencies, if we're making referral in advance, and say, if we were to be able to get a student to see you today, would you be able to accept them to make the system more smooth, etc. And Monique, I don't know if you have any other thoughts on this slide, so I just wanted to make that open as well.
I think with regard to the piece around which parts of the scenario, or even utilizing this as a debriefing model as well, which part tested your system, it can often look at in what ways did this individual test that system. It may be something as, wow, somebody's coming in at 4:45 and we close at 5, but we realize that a lot of people actually aren't in the building by that time even. So in what ways can we address that moving forward? Or how do we provide support to that individual that is staying and is interacting with that one student at that time? Another place where these scenarios may test the system, and we talk about it because we've been tested in these ways in multiple organizations, but in what ways can the system be tested if we're looking at a little bit about when and where? So we may have some information, but it also just happens to be Tuesday before the holiday break or those types of things. And we don't know how much we're going to be able to do in terms of activating additional support. So what do we use in those situations? And looking at those opportunities to test that is a great place. It's scary, but it gives you some additional pieces to work with. I know also later on in some of our slides, Philip has also provided some scenario-driven response actions. It's a great opportunity for you to check out even some of those opportunities for responding that can just be some great scenarios that you can work out in your teams and say, what would this look like if this type of scenario did impact our campus?
Thanks, Monique, for mentioning that. We should say at the onset we realize how much work you're doing and how little bandwidth we all have. So we're basically trying to scaffold up, if you will, some internal professional development by using these techniques to continue your process improvement. And so I think, Monique, as you said, that's kind of the theme here.
Definitely. So as we move forward, we are going to open it up for questions. If you would like to either use the chat box or to be able to verbally ask a question, we do have ample time for us to be able to check in with those. So we have a question in the chat box, how HIPAA impacts FERPA. A little bit with regard to HIPAA and FERPA, it's what your role is on the campus that you're working on. And so if there is somebody that might be working within HIPAA and how it impacts FERPA, HIPAA is a protection of protected health information. So while FERPA is an understanding about looking at how we're maintaining and protecting our student record information, it will look a little bit more stringent on the HIPAA side in terms of the information that you're going to be able to share. What I will say, though, is that the opportunities and creating a system in place within your campus, releases of information can be a helpful way to have that. Now, their question was also to go back from FERPA to HIPAA. FERPA does allow you a lot more, I would say, latitude to be able to communicating about those things into maybe a counseling center or somebody that might be holding that information. I often like to strategize around how we hold that information and how I may be able to input some information into a counseling center that may be helpful to their information. So I may say, I'm aware that Jim showed up today and this is the information that he said. It was concerning information about threats of harm to self. We already reached out to him and made that referral over to the counseling center, and this is the information I wanted to share with you so that if you have any engagement with that student or he shows up, you already know a little bit about some of the ways that we were supporting him. Really, I think utilizing that FERPA opportunity and being in that space to really inform how those that are working under HIPAA can support that student can be helpful. Any other questions, other things that are coming up? So I wanted to go back. There was a question around the BIT processes and understanding a little bit about how do you socialize what the role of BIT is on your campuses. I'm putting a link to a really helpful information from one of our colleagues around explaining the threat assessment process to your campus community. What this information does hold is really some general prompts around how you would be able to address some of their general questions around the BIT team. This might be connected just to your threat assessment teams or maybe connected more widely to also your care teams and the expectations that your care teams may have in supporting your students. So I definitely encourage everybody to look at the link, review that newsletter information, and see what components might fit best with how you might present that either in trainings or on any public-facing websites that you have to better inform those that are connecting with the BIT teams. And I know Philip has some to add about this as well.
I can just, I suppose, commiserate. We established at UC San Diego in 2007 a behavioral intervention team largely as a reaction to Virginia Tech. There was a model in place for student of concern, HR, faculty, etc. But what I can share with you in the intervening years was the value of meeting regularly with the campus leadership and with our faculty senate. I would suggest to you of all of the parts of that work that were and probably continue to be the most challenging is misunderstandings about what a behavioral intervention team is, the scope of the work that you can and cannot do, For instance, there were faculty members, has been indicated in a chat, that will basically say that they want a student removed from a classroom, and in some cases that might be appropriate, but clearly, at least my experience, I'll ask Monique to share hers, and probably the colleagues on this phone will agree, the majority of the cases that we see are in reaction to some behavior, not because someone has actually gone and researched what the behavioral intervention team does. That's unfortunate, but it seems to be human nature. So a lot of outreach to faculty senate, to faculty orientation, and getting on the calendar of senior leadership, I would suggest at least every quarter, just to give them an update as to the scope of the work that you're doing. And Monique, I don't know if that tracks with your experiences, but I'll turn it back to you.
Yes, definitely. I would definitely agree with what Philip is mentioning there. I will also add that providing some information and opportunities to really expand that place of consulting where a behavioral intervention team may not have that role or capacity to be removing a student from a classroom. And so understanding a little bit about that it's a multidisciplinary effort to understand what's the best and most effective intervention for that student. And also that we are always looking at the place of supporting that student from a 360 perspective, looking at both the places where it's going to be the most effective intervention for them to support them, but also the ways that we're going to continue to support the campus. So always that balance of that and seeing how do we do that. I always like to approach that with our faculty to make sure that they understand it's not a one-size-fits-all situation. And like Philip was saying, that may be indicated in some cases, but it's often not indicated in a place of activating all the support for all parties. Other questions from the group? I also wanted to be able to touch base on some resources that are available that are really helpful. Some of them we mentioned throughout the webinar this morning, but definitely encourage you to continue to check back onto the website if you haven't been there recently. There's just some updated information and always some really helpful tools and publications that can be helpful to this work.
While we're just gathering and coming to a close, I just want to thank you all for what you do. I think we realize the incredible work that you're doing, and with the limited resources that you're doing it with, and we understand that a 90-minute webinar doesn't answer all your questions, but we did want to provide takeaways, and probably the takeaways that we thought of when we were planning this was, how can we best help our peers when we know that they have so limited resources? So the idea of doing the pre-planning sessions, using the vignettes as part of your in-service training, and then some of the practical tips, so to speak. Beyond that, the idea there's this continuing education resource here with studentmentalhealth.org that you see. Again, we just so appreciate everything that you're doing, and we're peers in this, and we just wanted to share our experiences over the years with you here, and I'll turn it over to Monique.
Yes, I'd also like to say thank you to all of those that participated in the webinar today, those that provided some really helpful and engaging questions and feedback. And also, we've provided these similar types of these trainings and webinars on topics similar to this over the years. And it's great to see that we're moving and trending in a direction where there is more structure and more support for these types of resources on the community college campuses. So I really appreciate everybody's engagement, and we also are open to other questions even after the webinar is done. If there are any particular things that you would love for us to touch base on, that we're here to help and serve as a resource. So thank you again.
And thank you, a big thank you to our presenters for taking the time out today to share your wealth of information and knowledge with our group. And thanks for all for joining us today. So as a reminder, the CCC Health and Wellness website serves as a resource, and it is designed to help CCC leadership, faculty, staff, and students share best practices, collaborate, and develop innovative services and policies. So be sure to check out all of the helpful resources and links we have available for you. So again, I'd like to say a big thank you for joining us, and have a great afternoon.